Hi, my name is Nain Yuh, and I am the Programs Manager for Gender Equity and Inclusion at Effective Basic Services, eBase Africa for short. eBase is a multinational collaborative that seeks to improve the livelihoods of underserved population using innovation and best practice. And by underserved population here, we're looking at people living with disability, children, women, and the indigenous population. Very quickly, I share with you how the AEN Manifesto has contributed to changing the stories of people with disability in Bamenda, Cameroon, from red to green. In 2018, when we started the Waka project, our objective was to improve the livelihoods of people with disability using innovation and best practices. And proud to our intervention, we have realized that people with disability have been left behind the evidence-based practice stream, not because the evidence was not available, but because it was not produced in formats that were people-centered, was not produced in a way that would reach people with disability at their household and in a format that they can relate with, make sense out of it, and use it to make informed choices. And coming from communities that are characterized by myths, stigmatization, and misinformation around disability, all this fuels their decision making. And most of the projects that were being produced were developed for them and not with them, hence leaving out their voice. Now, what did we do differently? We co-created the intervention with the people with disability, ensuring that they prioritize the outcomes of interest. The result was an evidence toolkit that brings research not only to the households of people with disability in formats that are relatable and understandable by them, but through people whom they are already familiar with. These are community health workers. Now, how did the manifesto contribute to this work? Fast forward to 2020, when the AEN Manifesto was launched, it echoed on the work that we were doing and further strengthened our approach by highlighting that it is very important for capacity building to be inclusive and for evidence to be people-centered. These manifesto principles have since then guided the continued evolution of this work. In practical sense, what community health workers do is that they don't come to the households to lecture, but they come to listen with humility, to provide guidance with humility, to provide guidance to the people with disability, and to bridge research with real-life decisions in a language and format that people in the communities and in the household can understand and relate. The results: families of people with disability are now confident in the decisions that they make, which are evidence-informed around the health of their children, education, social well-being, livelihood, and their empowerment. Children with disability are also now enrolled in schools, as opposed to before when we started this project. They are now proud owners of disability cards, which give them a my own identity, bank accounts which they save there regularly. They are also proud owners of businesses which they run. Also, they now own insurance premiums, which not only covers them as people with disability, but also covers their entire family, giving them an opportunity to contribute to the well-being of their family. Now, this means that their stories have turned from red to green.